The US government just made one of the biggest policy moves in mental health in years. And if you have psychiatry services in your clinic, this affects your revenue, your compliance, and your business model. I'm going to break down exactly what changed, what the real risks are. And by the end of this video, I'm going to give you 3 concrete actions you can take right now as a clinic owner to align with these new rules and stay ahead. Not just to survive, actually stay ahead. This is not a political, this is operational. So what actually happened? On May 4th, the Secretary of HHS announced a federal initiative targeting the overuse of psychiatric medication, especially among children. This was a Maha Institute summit on mental health and over-medicalization in Washington, D.C. HHS sent a Dear Colleague letter to all providers, and the message was clear: prioritize informed consent, shared decision-making, and routinely reassess the risks and benefits of every psychiatric medication with every patient. And here's what I think is really important. The federal government officially listed what they now consider standard treatment options: therapy, family support, nutrition, and exercise. This is not a wellness block. This is a federal level language. This is a policy document. At the same time, CMS released new guidance. Physicians can now reimburse for helping patients safely taper off psychiatric medication and for monitoring withdrawals. Deprescribing is now a billable service under Medicare. This is new, and there is more coming. SAMHSA report on prescribing trends, educational webinars for prescribers through June and July, and a technical expert panel this summer to develop formal clinical guidelines on tapering and discontinuation. And this is moving fast. Let's talk about what this actually means for your practice. Because I know some of you are thinking, okay, this is federal news. Maybe it does not touch me directly. Well, it does. If you accept Medicare, Medicaid, or Medi-Cal, and if you have psychiatry services, this is your direct exposure zone. Ask yourself right now, what percentage of your psychiatry revenue comes from federal payers? Do you even know that number? If you don't, that's step 1. Know it. Here's the risk I want you to think about. There's a high probability that federal funding for psychiatric medication management services will be restructured, and deprescribing protocols may become a required standard of care, not optional. Required. Clinics that rely heavily on medication management as their primary psychiatry model, that model is under pressure right now. But here's what I also want you to see. CMS is already paying for deprescribing. This is a new billing opportunity. Most clinics are not using it yet. If you build a structured tapering and monitoring protocol, that is new revenue stream inside your existing psychiatric practice. Same team, new service, and new billing. So yes, there is a risk, and there is also opportunity. The question is, which side are you going to be on? If you're wondering what that actually looks like in practice, integrative, holistic care, nutrition, body-based intervention into the psychiatric model, there is a name for this. It's called functional psychiatry. And it's exactly what I built inside my own clinic. I'll tell you how and why in a moment. I added functional psychiatry to my clinic not because the government told me to. I added it because I went through something personally, something that changed the way I see psychiatry completely. I experienced firsthand what happened when the doctors look at the wrong thing. Basic blood work, hormones, gut health, nutrition, these things directly drive mental health symptoms. And traditional psychiatry was not looking there. I lived it. I understood this. And then I built it into my clinic. That was before any of this. Before HHS letters, before Maha summits, before any federal language about holistic care. And now the industry is catching up. So I'm going to tell you the full story in my next video. Why I made that decision, what it looks like inside the business, and what it can mean for your practice. The link is in the description. Watch it after this one. Let's talk about what to do. 3 actions to take right now. Action number 1. Audit your payer mix. What percentage of your psychiatry services runs through Medicare, Medicaid, or Medi-Cal? The number is your risk exposure. You need to know it today, not next month, today. Action number 2. Start looking at holistic services seriously, not as add-on. Therapy, nutrition support, lifestyle interventions. This is now the official language of federal mental health policy. Clinics that already offer this have a competitive advantage. Clinics that don't, they will be adding that later, under worse condition. You wanted to be ahead of this, right? Action number 3. Look into the CMS deprescribing billable codes. If you have a psychiatrist or a psychiatric nurse practitioner on your team, structured tapering and withdrawal monitoring is now reimbursable under Medicare. This is not just about compliance. This is a new service line. And right now, most clinics haven't touched it yet. The government shifted the standard of care. Holistic approaches are now federal policy. Deprescribing is now billable. And if you're heavy on federal payers for psychiatry, your model needs to evolve. I know it's a lot, but this is exactly what we track here. The trends that are changing the industry before they change your practice for you. Watch the next video on functional psychiatry. And if you're a clinic owner or provider looking to understand what's happening in the industry and how to build something sustainable, join us in the Global Alliance of Mental Health Professionals. Link is below. What kind of clinic owner are you going to be? The one that adapts now or the one that waits? That's for you to decide.